Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got a great exercise for those of you with degenerative discs known as the hip hinge with multiplanar challenges. Hope you enjoy. So in our previous videos, we have discussed the motion of the hip hinge, where you engage your core muscles to protect your spine in what we call a neutral or safe position, so that the discs that are degenerative and thinned out don't get as much stress. Now again, if you don't know what your unique posture and mechanical issues are, I invite you to go to either the Pain Free and Fit or Posture Size websites. We have a free body analysis there. Learn what kind of body tendencies you have in terms of leaning or muscle asymmetries or mechanical tendencies to abnormally stress your spine, so you can hold your spine in a neutral position when you do the hip hinge. In previous videos, we learned the hip hinge is holding a stable core in a neutral spine that's unique for you as we bend from the hip joint, as the entire body rolls forward from the pelvis without changing the relationship of the spine. The spine is simply going for a ride with the upper body on the pelvis, which is rotating forward on the thigh bones. However, in degenerative disc conditions, remember that most of the time, flexion, which is bending forward on the spine, is the most aggravating movement of all the different cardinal ranges of motion we can do. And any exercise that challenges our ability to resist flexion is going to be very good, because it's going to build up the extensor mechanism, which are the muscles on the back portion of the body, including the back, the buttocks, the hamstrings, the calves, the latissimus muscles, which run from our shoulder to our back. These muscles, the more we can strengthen them and train them in a coordinated fashion, holding our unique posture corrections and avoiding our unique mechanical tendencies, will resist the effect and the chances of us bending forward and slumping and flexing on those degenerative discs and irritating our degenerative disc pain. Today's exercise is going to include something called multiplanar challenges, which by using the arms, we can increase the lever arm or the moment arm, which acts on the spine, to increase that challenge and build up more strength in our extensors to resist flexion. So for instance, if we do a hip hinge with our arms at our sides, there is a certain amount of extension strength that's going to prevent my upper body from slumping forward and losing my neutral spine position. However, if I raise my arms a little overhead, now I have more weight further away from the center of gravity. There's a longer lever arm from my hips through the top of my body, and that's going to challenge those extensor muscles even more. The further I raise my arms up, the greater the stress, the greater the challenge, and as long as you maintain your neutral spine stability and good mechanics, the greater conditioning effect it's going to have on your body to build up this extensor strength and resist those forward moments that can irritate the disc. If I have a tendency to also have, with my degenerative disc condition, a tendency to, let's say, hip hike, where I raise one hip up towards the rib cage with certain movements, or lean my body to the side, that's a lateral component to stability as well. And I can increase my challenge to hold that correction by bringing one arm out to the side. Let's say I have a tendency to hip hike on the right, perhaps due to an external rotated leg habit, where I walk or stand with one leg turned out more than another. That, of course, creates hip hiking tendency on that side and torso side leaning into that side. And that typically is going to compress the degenerative disc on that side and overstretch the disc on the other. So if once I maintain a neutral spine, I perform my hip hinge with one arm out to the side, that arm out to the side is a longer lever. That's trying to lean me into that side again. So it makes me holding my ability to hold the rib cage and the pelvis away from each other and in a neutral square position much more difficult when my arm is out. My arm wants to bend me in. So on the side that I typically hip hike or lean to, that's the side I want to put my arm out with. If I get really good at that, I can hold a small weight in that hand or band resistance to make that even more challenging. If, on the other hand, I have a tendency to have a rotational tendency, meaning that perhaps my pelvis has a tendency to twist to one side, or my torso, due to daily posture habits or asymmetries between my abdominal oblique muscles, that's going to put an abnormal rotational stress on my discs and my lower back, and I can challenge that by bringing my arm across my body. Let's say, for instance, that in normal posture, my body wants to twist to the right-hand side. I watch TV, I do something asymmetrically every day where I've developed my external oblique muscle on this side and internal oblique on this side more so than their corresponding partners. And when I look in the mirror, I see that my shoulders and my upper body twist to one side. That's having a deleterious effect on my body in terms of stress on my lumbar spine. The low back degenerative discs love symmetry. With this hip hinge, I can then try to augment that by bringing my arm across. Whenever you bring your arm across, the side you're reaching towards, the body naturally likes to turn the torso that way. So if that's typically my problem, and during my hip hinge and all my rehabilitative exercises, I'm focusing on keeping my rib cage to the right, that's going to be more difficult if I bring my arm across that left side, because my torso wants to twist left, and as I do a hip hinge with that, it makes the challenge much greater in holding my torso in a neutral position, avoiding that tendency to twist in to that side. So these are a couple of concepts you can use with or without resistance. Again, when you're using resistance in multiplanar motions, make sure that it's very light at the beginning, light bands, light weights, use more just the weight of the arm, bringing it further away from the body to increase the stress progressively over your training program. If you like this video on hip hinging and multiplanar challenges, feel free to subscribe to our channel. We got a lot of great videos for degenerative discs to help your body turn on its healing stimulus and protect itself from injury. We also have a great program if you're looking to customize an exercise for yourself on our painfreeandfit.com website, the Fast Track Healing Exercise Program for Degenerative Disc Disease. It's got the whole package that most of us are looking for, from pain relief exercises, customizing stretching, coordination, strengthening, stability, neutral spine exercises, nutrition, and more, all in one package. If you'd like to help me share this valuable information with others, give me a thumbs up below. Any questions or comments, I'd be delighted to entertain them. Write in, we'll do our best to make a video to answer your question. And I hope this video series on multiplanar challenges with hip hinges helps with your degenerative disc disease.